there's a lot of evidence, there's a lot of growing bodies of evidence that are showing that different forms of manual medicine, whether that's physical therapy, massage, chiropractic, osteopathic manipulation, there's growing body of evidence over the last several decades studying these effects of these interventions to people who have chronic pain. So it's a little more difficult to do these sort of studies because you can't have, of course, a double-blinded study because you always know that someone's going to be doing an intervention on you. So it can't be something that's the gold standard from the pharmaceutical studies, but there is a lot of evidence that can show that these therapies are effective for patients dealing with chronic pain. What we're seeing today in medicine is we're kind of shying away from the old style of diagnosing someone. So it used to be that diagnosis was made by the bedside. The doctor would come into the clinic, they'd lay on the hands, they'd do an exam, listen with the stethoscope. You know, there was a lot of emphasis on the hands-on diagnostic ability. With the advent of modern technology, we're much more reliant on blood work and imaging studies. And I think there was a really interesting article several years ago about, I think it was someone who was working for CBS News, had an appendicitis, and she tracked herself through this procedures that she had a procedure and took her appendix out, and there was 9 doctors in her whole, like when she got admitted and left, and only one of them put her hands on her. And so we're seeing this, I mean, everyone's probably gone to the doctor and they're sitting behind the computer. And I think patients are craving this connection, the doctor-patient relationship has faded a little bit with technology, and we're able to diagnose and do things much differently. But that personal connection, I think, is what is important. And I think that's what builds that level of trust and rapport with the patients. And it helps the physicians because we get to understand and feel and know our patients much better as well. But general practitioners and any other providers are dealing with patients for chronic pain. I think just the ability to make referrals inside the local community that they live in, to get to know the people in that community because the cultures are different. Some, like in the West Coast, there might be more chiropractors than there are on the East Coast. In the South, there might be more physical therapists. So the biggest thing when I lecture, and I tell the general providers, I always tell them to get to know your local community, see who's there. There might be, it might be that your insurance network is supportive and for chiropractic care, or it might be that there's an HSA account that you can use for massage therapy, but know who to refer to and know when to refer to. You don't always have to prescribe medication, give injections right away. I think taking that first step of saying, hey, why don't you try physical therapy before we try this medication on you? Why don't you do levels of massage, get some acupuncture, try some yoga, some exercise therapy before we do any other medication or injection procedures. As an osteopathic family physician, I do all the hands-on techniques from the manual medicine side of things, but I'm also the director for the Center for Integrative Medicine at UC San Diego. And with that, we do a lot of different interventions, whether it's massage therapy, nutrition, psychology, acupuncture, osteopathy, and we're treating all different disease states. For chronic pain, we can give a plethora and smorgasbord of all these offerings for these types of individuals that are suffering from chronic pain, just to show that there's a lot of different options out there that can help them. And there's good evidence to show that that can be very helpful, especially this culture we are now where we're dealing with this opioid crisis, that there are alternatives to that have been shown to be effective.